Hi, everybody. My name is Kara Waskiewicz. I'm the Director of Women's Wellness and Longevity here at Bucky Plastic Surgery. We would love to welcome you to our Bioidentical Hormone Replacement Therapy virtual event. We are so excited to offer these services here at Bucky Plastic Surgery and the Bucky Body Center. The topic of perimenopause, menopause, and bioidentical hormone replacement is really near and dear to my heart. So I have a lot of great information for you guys here tonight, and I know there will be a lot of questions. So try and sit back and enjoy, let it all soak in. And then at the end, we're going to have a live Q&A so that I can answer anything that you may be wondering. So what are the biological factors responsible for low hormone levels? While all women are born with a finite amount of eggs in our ovaries, these eggs are responsible for producing hormones like estrogen and progesterone. Once we run out of these eggs, which will happen to all of us if we're blessed to live long enough, we stop making these hormones. And then you are left in a state of low progesterone, low estrogen, and low testosterone. It kind of feels like a reverse puberty. At one point, all these hormones were introduced to your body, and we all know how that felt, and now you're going through it in the reverse. So classically, when we're talking about symptoms of perimenopause and menopause, we're thinking of hot flashes and night sweats. And though those are incredibly troublesome symptoms and things that I deal with all the time with my patients, there is so much more. So this can look like insomnia, brain fog, fatigue, hair loss, mood changes, weight gain, changes as a result of these mood changes to your interpersonal relationships with husbands, kids, coworkers, changes to your hair, skin, and nails, low libido, vaginal dryness, urinary incontinence, and frequent UTIs. These are all symptoms associated with the loss of hormones like estrogen and testosterone. That's what's going on the surface. There are many chronic conditions that women are dealing with and that are contributing to significant increase in morbidity and mortality, such as osteopenia and osteoporosis, or loss of bone mass density, cardiovascular changes, increasing our risk for heart attacks, changes to our brain function and structure leading to disease like Alzheimer's and dementia. And all of this can be tied to a loss of these hormones. So this is about symptom management, but it's really also about promoting longevity and optimization for quality of life long past 50. For many years, women have suffered through these symptoms in silence, and medicine has not really had much to offer us as far as what do we do about it. I'm so glad that there's been so much change in the world of women's health and hormone replacement specifically, and I'm really excited that we can offer these things here for you at Bucky Plastic Surgery. So we can talk about the symptoms that you're experiencing, the hormones that correlate with loss of those symptoms, and the solutions that we have to offer to replace those hormones. So in this practice, I will always be using a bioidentical hormone replacement therapy, which means I'm using a hormone that is the same molecular structure as what your ovaries were once making. So it's going to behave the same way, treat the same symptoms that are happening as a result of loss of those hormones, and really help to promote longevity and optimization of your whole body's functioning. So what does replacement of these hormones and treatment of these symptoms look like? I practice a very individualized and personalized approach to hormone replacement therapy, which means that I offer all modalities that are really available now so that we can really personalize this to you. Everybody's going to be a little bit different in the symptoms that they're dealing with and the method that works best for them to replace it. So I will offer things like patches that you wear on your skin and change twice a week, creams that you apply on a daily basis. I offer subcutaneous pellets, which are more of a sit it and quit it method, something that's going to sit under the skin and slowly release over time. So we have a lot of options available here for you, and I am more than willing to work with you and find what option works best for you based on your lifestyle, based on your history, your genetics, your symptoms, the testing that we do to monitor all of this, and so on. Okay, so what is bioidentical hormone replacement therapy? This is a therapy that uses bioidentical hormones such as estrogen, progesterone, and testosterone to replace what is lost through the transition of perimenopause and menopause. This is something that all women will go through if we're blessed to live that long. We are born with a finite amount of eggs that are responsible for producing these hormones. Once those eggs run out, we lose these hormones, and the symptoms that we deal with as a result can be really life-altering. And so we've kind of toughed through it for many years now, but there are wonderful solutions such as bioidentical hormone replacement out there that we don't have to be dealing with these symptoms and a total loss of quality of life. So what does this look like? What is my approach in administering these therapies and monitoring and working with you to make sure that everything is going as we want it to? I will always start with a panel of blood work to kind of get a baseline for where your hormones are at. You may have done this and been told by another doctor that everything looks normal, but that is not the lens that I will interpret it with. Everybody, especially in perimenopause, is going to feel different symptoms at different levels of hormones. So I'm most concerned with the person in front of me and what you're experiencing, but we'll use data like blood work and urine testing to kind of help further guide things and make sure we're optimizing this program for you. So we'll start with an initial panel of blood work prior to our first consultation. We'll go through that, make sure you have an understanding of kind of where you're at in this timeline, and talk about options that make sense based on what we're seeing there and what you're telling me. After that point, we continue to monitor blood work, generally about 4 weeks after therapy, and then about every 3 months ongoing. When we get to a more stable place, kind of outside that first year of starting therapy, we can space these out a little bit more as we feel more confident about where your levels are and how you're feeling on therapy. If you are someone who ultimately goes with the pellet therapy, that's something that, like I said, we'll do about every 3 to 6 months. A big part of my program and personalization of this hormone replacement to you is the use of a urine hormone test called the Dutch test, which stands for the dried urine test for comprehensive hormones. This allows me to not only assess quantity, but quality of your hormones. So how are you metabolizing them? How are those metabolites behaving in your body? And how can we further optimize that process to make sure you're reaping all the benefits of these hormones and also making sure that your symptoms are well managed? So who is the ideal candidate for this program? Really, any woman 35 and older who's dealing with these symptoms. If you're younger than that, I still want to talk to you and find out what we can do for you. Like I said, there's a lot of variability in how we're all going to experience this transition, and your blood work and your history doesn't have to be a closed door on what's available for you. So I'm always open to a conversation to find out what can work best for you, even if it's not hormone replacement, talking about diet, lifestyle, supplementation that's going to help you through this transition. This program will also include monitoring of things like a mammogram, as well as a DEXA scan to take a look at that bone mass density that's significantly impacted by changes in these hormones. So I mentioned changes under the surface that happen as a result of these hormones, things like weight gain, changes to body composition, and loss of bone mass density. We have a great tool here at the Bucky Body Center and the Bucky Plastic Surgery location in Ardmore called a DEXA scanner, which allows us to really assess what's going on in terms of your body composition and bone mass density. This is something that will be included in the yearly program and that we will continue to monitor as time goes on to ensure that we're not only preserving, but ideally optimizing your bone mass density, body composition, and so on. So there are a lot of options out there when it comes to seeking care for symptoms and changes as a result of perimenopause and menopause, but it's really important that you're choosing the right team to help guide you through this. And here at Bucky Plastic Surgery and the Bucky Body Center, we really have a great team and great resources to help you feel your best, not only on the outside, but on the inside as well. So I will always, like I said, practice a very individualized, personalized hormone replacement therapy program that allows you to work with me in a way that you get exactly what you want out of this. We'll talk about your goals, we'll talk about symptom management, we'll talk about longevity and how we monitor all of that to our best extent.
I've been a patient of Kara's for the last 5 years. I started seeing her when I was experiencing some symptoms of perimenopause, insomnia, fatigue, brain fog, some slight night sweats. And during our consultation, she explained to me the benefits of bioidentical hormones. And we started with a low dose, and the results were truly amazing. They were life-changing for me. And through the last 5 years, we've adjusted doses based on my symptoms, and she is incredible. She's an incredible provider. She is sympathetic, and she will listen to whatever problems that you're having, and she will make sure that you're feeling the best you can absolutely feel.
So I will say this is my fourth place that I've tried, and I've been really impressed with Kara and her knowledge, her experience. She's already doing things like blood work and communicating and educating me in a way that I haven't experienced. I'm really impressed with her background and her history, her work history. And she's also really warm and makes you feel very normal about everything that you're experiencing, which can be really hard. And she just has a way of making you feel really comfortable.
Thank you all so much for attending tonight's event. We went through a lot of information about our new Women's Wellness and Longevity program here. So now's the time we're going to have about 15-20 minutes to answer any questions that you may have. Enter them into the question box. This is a whole new world for most of us, so no question is too silly. It will be anonymous, and I'm happy to answer anything that's going to help you understand what this program offers, what you're dealing with, what your options may be, any fears that you may have, and so on. So no question is a bad question. Look out for a text from us after tonight's event. Give us a response back if you're interested in booking a consultation, and someone from the clinic will reach out to you for more information. Alrighty, hi everyone. Thank you so much for being here. We're really excited to talk some more about hormone replacement. I'm really excited to jump into some questions here and see what else everyone wants to learn. So I'm gonna pop over to the question box and go through these here. Big thing I want to talk about, there's a lot of questions of what if I am post-menopause? What if I have made it through perimenopause and it's been a while since my last menstrual period? Is this therapy still for me? Absolutely. There are many benefits, like I mentioned in the video about longevity. We're talking about your bone mass density, brain structure and function. There's changes to your cardiovascular health. We're at higher risk for things like heart attack when we lose these hormones. So there are absolutely benefits outside symptom management. And even if you're kind of outside of that window, we want to talk about what does the next 20 years of your life look like? How can we optimize that? How can we promote better quality of life and prevent the things that are putting us in nursing homes, putting us in hospitals, and kind of robbing us of independence? So absolutely there's a place for that. And in terms of testing for that, there's questions as to testing in perimenopause and menopause. I am implementing the use of blood work as well as urine testing, like I mentioned in perimenopause, and someone's question alluded to this. Absolutely, levels are swinging all over the place from month to month. And so there are timelines that I will aim to get testing done within to kind of give us an idea. But the reality is, like I said, it's really all about the person in front of me. I'd like to get testing to establish a baseline before starting treatment, but it's not really where I hang my hat in terms of determining the therapy for you. This is really based on your history, the symptoms you're experiencing, your goals, and so on. And for that testing, like I said, I'm doing things like a comprehensive panel of blood work, as well as implementing things like a urine test called the Dutch test. Someone asked about what are risks and side effects associated with BHRT. That's a great question. This is another one where it's going to be a little bit different for everyone. In terms of risks, everybody's big concerns about the use of this therapy is the result of a study that was published in the early 2000s called the Women's Health Initiative. And this was our really only first look at what these therapies mean for women in terms of benefits and risk. And unfortunately, it was done very poorly, and the data is something that we hung on to for a long time. However, each time we've reanalyzed that data, there's been subsequent publications that have really highlighted a complete misinterpretation of the original publication, essentially. We are not at a greater risk for things like breast cancer by using hormone replacement therapy versus the general population. This also ties into the conversation of a bioidentical versus synthetic hormone. So in that trial, they were using synthetic hormones like ethinyl estradiol, this is what's in the birth control pill, and something called progestin, which is a synthetic progesterone. These are the a big part of what's been correlated with increased incidence of breast cancer, the progestin specifically. When we, eliminate some of these variables, like I said, there is not a greater risk for breast cancer than the general population when you are on hormone replacement therapy, and in many cases, it's often protective against things like this, as well as osteoporosis, dementia, cardiovascular disease, things that I mentioned previously. Great question about if you've had your ovaries removed, if you've had a hysterectomy and oophorectomy due to severe endometriosis. So there's a couple layers to this question here, but I often say to patients, I wish that the conversation of hormone replacement was one that you had in the OR after you had a hysterectomy. Perimenopause is less predictable than someone going out and taking those ovaries out entirely. We know that there is going to be a complete loss of these hormones once we do that. If your ovaries are left in place with that procedure, there's some gray area there as to what's going to kind of happen with your levels. But if we remove ovaries and uterus, we're going to lose things like estrogen and progesterone immediately. And so hormone replacement should absolutely be part of the conversation. If you have a history of something like endometriosis, this is something that we want to dive a little deeper in, understand what's kind of driving that process, and make sure that we're not expecting manifestations of that elsewhere. And that's where things like Dutch testing and an in-depth history and blood work and things like that come into play. Okay. Question about the DEXA scan. I love our DEXA scanner here because yes, the question is asking, does it measure specific areas of bone to give a T-score and a Z-score? I heard the DEXA scans used for fat composition don't give those scores. We can get it all. We need to get different imaging. I need to position your legs differently in order to get a T-score and a Z-score, but that's absolutely something we want to do. That's often what if you're following someone who's treating you for osteopenia, osteoporosis, those are the scores they're going to want to see, and it's going to give us some objective variables to measure moving forward. So what I love about this scanner is, yes, absolutely, we can get those values, but we can also take a look at body mass composition. We really want to make sure we're preserving all lean body mass, muscle, and bone as we age as women. It's really important to our overall well-being, and so that's why I love to use that scanner here. So yes, absolutely, we can get T-scores with that. What's the question, or what's the difference between BHRT and HRT? Why do I choose BHRT? BHRT is really just the way we're describing this type of hormone replacement. This is a plant-derived bioidentical hormone, which means it's the same molecule that your ovaries were once making. What was previously used in years past, and what was done for that Women's Health Initiative, was the use of synthetic hormones. So the ethinyl estradiol, which is actually derived from horse urine, it's a conjugated equine estrogen. It's not our estrogen. It does not behave in the body in the same way. Same thing with the progestin. It's a synthetic progestin. It does not bind to receptors in the same way that the bioidentical hormones will. And so there's definitely a big difference here, and there's a lot of benefit to picking the right kind. So I'm definitely passionate about using the bioidenticals. We have a lot of options when it comes to payment here. So this is going to be individualized. This, like I said, this is a very personalized, individualized program. So it's going to look a little bit different for everybody, but we do have lots of financing options through things like Patient Fi. We have the Bucky Black Card, which is going to get you 20% discount on these services. So again, a lot of options, and that's something that we can talk about in a consult and see what works best for you. Is this program different than what my gynecologist has put me on, which is the estrogen patch and progesterone? That's a great question. Those are both two therapies that I will use in this program. What I will say is that this therapy really requires an individualized and personalized approach. Everybody is going to be a little bit different. I have been working with this patient population now for the last 4 years, and every single patient has presented a little bit differently. What I love about what we're offering here is this ability to work with me in a way that allows us to alter and tailor things to you, to optimize things by using testing like blood work and the DEXA scan and the Dutch. So while these therapies are available to you, your gynecologist is dealing with a lot of different things, and truthfully, our conventional education did not cater to hormone replacement therapy. And so this is something that, there's really a benefit in working with someone who can, be a teammate for you. That's my goal, is to be a partner in your healthcare and really sit in the driver's seat with you to make sure that you're getting everything that you can out of this. If my periods are regular and I don't have any major symptoms, is this program right for me? I'm in my upper 40s. There is never a wrong time to start paying attention to your hormones. I wish this was more of a conversation for everyone, starting from when we hit puberty and start experiencing all these things. So I think it's a good time to kind of get a look at what's going on with some of these levels, get a look at brain hormones, and see, how signaling is going there. Maybe get a better idea of what those symptoms look like. Oftentimes I'm talking with women who aren't really aware that the symptoms that have been labeled as just kind of a general consequence of female aging or just the female existence are actually a result of dysregulated hormones. So I think the best place to start, come in for a consult. We can get some blood work, get an idea of what you're dealing with. I can give you a better idea of what the spectrum of perimenopause and menopause symptoms look like, and then we can see, if it would be a good fit for you. Do I schedule in Ardmore office? Absolutely. I'm in Ardmore every Wednesday. Do I use natural supplementation as an option? Absolutely. So my background is in functional and integrative medicine, and a big part of what I use is bioidentical hormone replacement, but that toolkit does not end there. They are going to do a lot of the heavy lifting, the hormones, but it's not going to do all of the work for us. So big part of this program, and to kind of go back to the question about how is this different from what I'm doing with my gynecologist, this is really a comprehensive wellness program. So again, hormones do a lot of the heavy lifting, but they're not going to take care of all of our problems for us. So we need to be sure that we're laying the foundation to reap all the benefits from this. And again, another great thing that we can discuss in greater detail at a consult. Is the bioidentical hormone therapy suggested if I'm trying to get pregnant within the next few months? This is not the therapy for you if you're trying to get pregnant. There are certainly other things that we can talk about in terms of optimizing your hormones so that pregnancy is not only achievable, but an enjoyable process, and your body is best optimized for that. So I absolutely can help you with that process. However, hormone replacement is not necessarily the right therapy for you. Is there an upper age limit to the therapy? This is a great question. In one's 60s, the issues can only get worse, and the therapy could potentially be very helpful. Absolutely. There's a lot of different schools of thought, and as we continue to do more research and have this body of medicine evolve, there have been previous schools of thought as to like a timing hypothesis to these hormones. The fears that were previously expressed about when we are starting this, and any potential risk if we're starting this later in life are, again, overstated and much more of a nuanced conversation. So in terms of paying attention to bone mass density and chronic UTI, again, two things that are putting women in our 60s, 70s, 80s in hospitals, in nursing homes, and really robbing us of our independence. These are things that can be massively helped with the use of hormone replacement. So, should still be a conversation well past our 60s. Absolutely. Can you explain the DEXA scan and how knowing your numbers will benefit? Absolutely. If you've had a DEXA scan previously with another provider, that's something that we will continue to follow. Again, the benefit here, it's included in the program. We can do that on a more frequent basis and make sure that the treatments that we're implementing are benefiting you in terms of symptom management as well as bone mass density. So having that baseline is certainly helpful. I will also recommend DEXA scanning much earlier than your typical provider would. We're not getting guidelines, don't recommend that scan until age 65. And I am generally recommending that a year after your last menstrual period, knowing that when that ceases, we are losing this estrogen, and every year we spend without estrogen is a year that we are losing bone mass density. Let's see here. Do we have any questions on here? Questions as to what I prescribe. There's a question about the use of oral HRT. I do not use oral hormones. There are definitely concerns about anything we take orally is going to need to be processed through the liver, which can certainly increase clotting factors, can cause problems with the metabolism of those hormones. And so our methodologies are not including oral hormones. I have mild symptoms. Is it worth going on? And I have generalized anxiety. Will HRT make it worse? Quite the opposite, actually. We certainly would want to get a better idea of your history and kind of the onset of that. Was there any correlation with your cycle when you're younger? We can definitely draw a lot of parallels between symptoms that you experienced, in the week to 2 weeks leading up to your period and what perimenopause and menopause might look like. Again, I think this is another conversation of what is mild symptoms, what is really detracting from quality of life for you. I think, unfortunately, we have a really low bar when it comes to what it means to be well as a woman. And my goal is really to raise that bar and to ask for more, in terms of quality of life. As a reminder, you will be receiving a text message at the end of this. Please reply with the code Bucky, all caps, to be contacted for a consultation with me. How long does it take to feel a difference once I start? That's a great question. Everybody's a little bit different, and it certainly depends on the symptoms that you're dealing with. Things like hot flashes and night sweats are generally should be quickly remediated, and those are always indications for us to adjust therapy if that's not changing. So for some of the symptoms, it's going to be really quick. For others, it's going to be more of a trial and error process, which is the case with starting this therapy. Like I said, everybody's a little bit different, and that's why I really like to offer a program where we can be in frequent contact, have lots of communication, and make sure that we are constantly tailoring that to fit your needs. Okay, lots of questions about what impact does this have on weight gain. So great question. Is probably one of the most common that I get. Everybody knows that our body changes when we go through perimenopause, just like our body changed when we went through puberty. So oftentimes it's expressed that I'm doing the same things I've always been doing. I'm eating well, I'm exercising, and I'm doing what I know has previously worked for me, and it's just not working anymore. I can't lose this weight. My body composition has changed. My clothes don't fit the same way, and there's a lot of reasons for that. The loss of these hormones will cause us to lose lean body mass. They will cause our microbiome to shift, our cardiovascular and our metabolism to change, and that can certainly contribute to weight gain. And so getting a better balance in implementing hormone replacement therapy can certainly be helpful to body mass, and body composition goals. Do I treat patients who have a family history of breast cancer? Yes. Again, the conversation with estrogen and breast cancer is much more nuanced than we've, previously given credit. I like to utilize things like mammograms and breast screenings, like breast imaging like that, as well as the Dutch test, which again allows us to evaluate your estrogen metabolism. It's not so black and white to say estrogen does or does not cause cancer. Just like anything else we're encountering in our environment, it's all about what our body does with it. So that Dutch urine test is a really great screening tool to get an understanding of what you're doing with that estrogen that we're giving you. Question, if the issues, aren't necessarily related to bone density, falls, UTI, but issues of libido, etc., things that we've lost with changes of these hormones, even at 60. If it's still symptoms, if it's still an age 60, hot flashes, night sweats, low libido, brain fog, vaginal dryness, absolutely, this can still be a conversation of symptom management. Many times we get past this point, the point of volatile hormones, and some of that kind of calms down. And so that's why I allude to the benefits in terms of longevity. But absolutely, we can still expect benefits in terms of symptom management. That's another thing that's a part of the program that I will offer here that is not traditionally offered with your GYN. Women don't get enough credit for the role that testosterone plays in our health, especially when it comes to libido, muscle mass, bone mass density. And so that is, available in this program here. And speaking of testosterone, though it is important for women, also we know this as a very traditionally male hormone. Someone asked about, their husband is interested in testosterone placement. Do we offer this for men? Absolutely. I've treated men and women over the past few years, and men can deal with a lot of the same issues: low libido, erectile dysfunction, depression, brain fog, changes in body composition like loss of muscle mass. So absolutely, we can help the men and the husbands as well. Again, I started HRT with another provider, but I'm still struggling with symptoms. Is there anything else that can be done? Again, this is something that I think it's really important to have someone who's willing to work with you and make adjustments and kind of set a higher bar for what it means for you to feel well. So we can certainly do a deeper dive. We have a wide range of modalities available here that would not necessarily be available with a GYN. So absolutely. If I missed any here. Just a reminder for everyone, if you sign up for our services within a week of this program, so by June 6th, you will receive $500 off those services. So you can, again, reply to that text you're going to get for a consult. You can give us a call at the Body Center or Ardmore location. Easiest way would be to respond to that text. While in perimenopause, I assume I am technically still capable of getting pregnant even if not trying. Is there a risk to me or baby if I get pregnant while on BHRT? That's a great kind of complicated question. Generally, we're going to impact the cycle when we bring other hormones on board. So things are going to change in terms of fertility. That's why I mentioned earlier, if you are looking to get pregnant, this is not the therapy for you. So again, this would be a more in-depth conversation. I would certainly encourage you to come in for a consultation so we can talk about what monitoring looks like, what contraception looks like, and all of the nuances of that. Insurance does not cover the services. However, the blood work that is ordered will be external and has potential to be covered by insurance. That is an ever-changing landscape that I can't always speak to, but this is a great question. If I have an IUD with progesterone, will that need to be removed before beginning treatment? Not necessarily. So this is kind of part of the conversation with, if contraception is still required, we can think about something like a progestin IUD. It's oftentimes used in hormone replacement therapy for protection of the uterus, either in set cases where contraception is needed or in cases where progesterone and other modalities cannot be tolerated. So if that's working for you and it's a part of kind of what's keeping you well or what's working for your lifestyle right now, it is not something that has to be removed. What is my training and experience? I am a physician assistant. I graduated from Lock Haven University. I've spent the last 3 or 4 years with Jefferson's Department of Integrative Medicine and Nutritional Sciences, which is really where I kind of found my niche in this hormone world. I'm one of 3 sisters. I have 10 aunts. I have a lot of wonderful women in my life, so I'm very passionate about this. Women have gone far too long with these issues not being heard and in many cases being dismissed. And it's really what's contributing to our decline as we age. So it's really important to me. So I really found a passion in this. I do almost constant continuing education in this realm because I love to learn about it. I love to talk about it. So yeah, this has kind of been my world for the last few years here. If you have a Bucky Black card, you can use it towards hormone replacement therapy, and there is a 20% discount. That was one of the questions. Can BHRT improve my skin, hair, or prevent signs of aging? Absolutely. This is another place where multiple modalities are really helpful here. Many people have become familiar in the aesthetic world with the use of topical estrogen for wrinkles and for collagen and for fine lines and things like this. We know that the loss of estrogen throughout the body will contribute to changes in skin elasticity, lubrication. This is not just the skin of the face, but the vaginal wall. This is sometimes in the ears causing symptoms like tinnitus. So we're losing lubrication, we're losing that kind of fluid throughout the body, and it can certainly contribute to signs of aging. So an optimized hormone program can certainly be helpful for those symptoms. I will be available for telemedicine for this. Out of state will be subject to change in the future. Currently, I can see patients in the state of Pennsylvania only. Question about mood swings. Can BHRT help with mood swings? Other than osteoporosis, I would say this is probably one of my favorite applications and one that just doesn't get enough credit. I think that midlife as a woman can be really challenging, and we have kids agendas, we have work, we have a million things on our plate. And so when we're presenting to our physicians with depression, anxiety, mood swings, irritability, it's often immediately written off as, well, yeah, life is hard and you should learn to deal with it. But if you have experienced mood changes as a result of your hormones in the past, or you're experiencing it now, it's something entirely different. You don't feel like yourself. You feel irritated by things that wouldn't normally irritate you. You feel just pretty volatile. And we can absolutely see changes in that when we implement an optimized hormone replacement therapy program. And I think that's where we're most life altering here, because that can be really impactful in your interpersonal relationships, in your professional life. You're now at a time where we should be able to enjoy and reap the benefits of all the hard work that you've done, and feel well and feel happy in your day to day. So again, one of my favorite applications for that. Okay, so just a reminder again, if you get that text, please reply with the code word Bucky, all caps, to be contacted for a consultation with me. If you book that consultation within the next week, so by June 6th, you will be eligible for $500 off of those services. Okay. I think that's all we have time for tonight. Thank you so much, everyone, for coming. Hopefully we'll do more of these in the future. I love talking about hormones. So any questions, come in and chat with me. We can get into more detail in a consult. We are offering those for free, so you can, get to know more about this program and see where it would be, a good fit for you. But thank you, everyone, so much for joining. This is a topic very near and dear to my heart, so I really appreciate everyone's participation. Okay, I'm all done, Tracy.